Which of the following diagnoses best fit the presentation? 26-year-old individual assigned female at birth presents to clinic expressing strong desire to live as a man. Patient has been experiencing persistent discomfort with female gender role, has strong desire to change primary and secondary sex characteristics to match their gender identity. No history of psychotic disorders. Which of the following best fits the presentation? So this is um, like a psych issue, gender dysphoria, transvestic disorder, body dysmorphic disorder. That's not it. Schizophrenia, that's not it. Bipolar, that's not it. Gender dysmorphia, they're not transvestic disorder. They don't dysphoria is like they don't I wouldn't say they hate who like they are. They just want to be a different gender that they were assigned at birth. I would say transvestic disorder.
So what's transvestic disorder? So let's talk about this, right? So bipolar, right? You know, bipolar is your ups and downs, right? So you have manic events, so that's unlikely it. Schizophrenia, right? You have you know, audio sometimes audio hallucinations, also with flat affect, things like that. So that's not it. Body dysmorphic disorder, right? That's where, you know, we always joke, but bodybuilders, right, have body dysmorphic disorder, right? A lot of times, right? So no matter how big or strong you get, right, you feel as though you're small. So that's not it here. So you get between these two. So I'm gonna help you remember this real easy. Transvestic disorder. What's a transvestite?
Has both, right? No, that's a wow, I can't remember the word.
So transvestite is someone who is transvestite. They like to dress up the opposite gender, right?
Okay.
So transvestic disorder is probably someone who wants to dress up as the opposite gender, right? Do you think this person has that?
Oh no, it would be so it was gender dysmorphia. So
Yeah, so I want you to
dressing
keep
up.
it more simple, right? So gender dysphoria, right? If you're dealing with a lot of a female that identifies as a male that also wants to physically also be a male, that's going to be dysphoria, right? Meaning that you feel like the gender that you have been born into is not the correct gender that fits kind of your mentality. Okay. Transvestic is like I just remember like a transvestite, right? It's kind of where you cross dress, right? Which is not, this is not the psych issue at hand here.
Got
Okay.
it. Okay.
So keep it simple. Don't overthink. Sometimes if you're like, if you're not sure what transvestite is or transvestic disorder is, right? You can't pick it. Remember your mind for test taking strategies, right? Because you couldn't support it, right? So
Yeah. Yeah.